My name is Rufus Akinyemi. I'm a professor of Geriatric Neurology and Translational Neuroscience at the University of Ibadan, Nigeria. I'm really excited to engage with this very important conference in Davos, organized by the Davos Alzheimer's Collaborative Initiative. I would have been with you physically, but for some logistic challenges. Nonetheless, I'm happy to engage part of this training through this virtual platform. I am a translational neuroscientist. I work across the bench, the bedside, and the community in Nigeria. And of course, I work across multiple countries in Africa as well through my leadership engagement. Brain health is a subject of current global focus. We've heard of concepts like brain health, brain capital, brain economy. It is as important globally as it is important for the African continent. And the need for us to really improve brain health in Africa is critical at this time more than ever before. For us in Africa, there's several challenges of brain health, several challenges ranging from post-economic conditions to climate change, to conflicts, to famine, and poor education, poor governmental policies, and a myriad of communicable and non-communicable diseases, all of which ultimately impact negatively on brain health. But it is very important for us to promote brain health in Africa because Africa is a very strategic continent. Currently, of the over 2 billion people on the African continent across 54 nations, the mean age is less than 20 years, meaning that Africa is a predominantly young continent, that it consists of predominantly young people. And if we invest sufficiently in the brain health of these young Africans across the life course, right from the womb to old age, this will have a positive transformative impact, not only on the economy of Africa, but on the entire global economy. We know how well people move from Africa to other continents, especially in the global north, in pursuit of fulfillment, in pursuit of achieving economic dreams. But if we invest adequately in the brain of Africans, this will enable Africans to transform their continent, because Africa is a very, very rich continent, very rich and diverse genetically, economically, socially, culturally, and geographically. Africa is a very wealthy continent with a lot of very rich raw materials within the soil of the African continent. So promoting brain health would enable Africa to key into the global brain economy and solve our own problems and contribute positively, able to moving the entire globe forward. How can we do this? Yes, we know that there are several initiatives that are coming on board. While the WHO that is currently promoting the brain health program, we are very grateful to the Davos Alzheimer's Collaborative Initiative that is promoting brain health globally, and we are particularly for its focus on Africa at the moment. We as Africans were very ready to work with the Davos Alzheimer's initiative to move brain health forward in Africa. Yes, the African brain health ecosystem is currently not well organized. There are pockets of efforts of individuals, groups that are working in silos. So there is a need to integrate all these efforts, bring them under an umbrella or on a platform that can ensure that we work together. The African principle of Ubuntu, which speaks of collective intelligence, needs to be appropriated to move the brain health agenda forward on the continent. Having involved the last couple of years on research on two major brain disorders, stroke and dementia, which we all know are the biggest threat to brain health globally and particularly on the African continent. So we're ready to work with the African Brain Health Task Force, which is being promoted or being mooted by DAC to further enhance the brain health on the continent. We have several colleagues working with us in a multidisciplinary framework, these two different platforms. And we have projects across multiple African countries. We're ready to deploy these human resources to promote brain health in Africa. We're ready to work with governments so that to promote the policy implications or the findings of our research. We're ready to promote brain health awareness on the continent. We're ready to deploy existing resources. Yes, we know that Africa is lacking multiple resources, human resources and infrastructure to undertake research and of course to undertake implementation activities. We're ready to deploy the resources at our disposal through these platforms to engage in task shifting and task sharing efforts, working with government at multiple levels, working with advocacy organizations, working with global North partners and all friends of Africa to move the agenda from brain health forward on the continent. I'd like to thank you once again for giving me this opportunity to share some thoughts with this very respected audience. Thank you very much for your attention.